I'm Frederick Mugoya from Rumbies CU, Namagogo community area, village area.
Okay.
Yeah.
And how long have you been a community health promoter?
I've been a community health promoter for more than 20 years now. Yeah.
Okay. So,
We are working with the different partners.
right?
For me, I've worked with the MSF Spain. I've worked with the Western Region Anglican, dealing with the people living with the disability.
Right.
From there, I've been home-based care, working on people living with the HIV and AIDS. After which, when it first out, I went to the government sector, whereby I'm working up to that now.
Okay.
Yeah.
And so now you're focusing on malaria
And
respiratory and diarrheal?
Yeah.
Okay. So, as a community health promoter, what are the things that you need to make your job effective?
You know, my catchment areas are a little bit bigger. I'll need something which will make me to reach community clients at a time, and that is if I can get something like a bicycle. It can enable me to.
So now you walk.
Yeah.
And how far do you walk from village to
You
village?
know, our radius where I'm working, it's about a kilometer, a radius of the distance of a kilometer.
Okay.
So sometimes it is impossible to reach other people in time. Another thing that I would like to get so that it can support me is personal protectives like gumboots,
Yes, gumboots.
raincoat, and probably umbrella.
Okay. What about a backpack?
A
to put-
backpack to carry
commodities.
my items,
Right.
and also gumboots.
When you're working
Yeah.
in the clinic,
Yeah.
are there enough items? Are there
No.
test kits?
In
Are
fact, in test kits for malaria, we have lacked for it for quite of the time. From November, we have not received any test kit for malaria, nor medication. So we are suffering, and in our kit, as we have been doing it previously,
Right.
we have never had any new paracetamol to manage fever and whatever.
Right.
Yeah.
Right. So how do you treat? If you don't have the supplies, how do you treat?
For now, we only but refer. And unfortunately, even in this facility, we cannot refer our clients as it has no lab technician who can work on microscope. So as we are missing RDTs, which means even services here for malaria are not being serviced because we don't have those the technician to work on microscope.
Microscope.
Yeah.
Right.
We
Right.
had hired hours as management, but he has been employed and deployed to another facility. So we are not at now. We don't have malaria services in this facility or in this catchment area.
Okay.
Another thing that we would like you to assist us with, you know, we need also to work with the government, and we have a global campaign on environmental health, isn't it? We want to improve on environment.
Right. So you mentioned government.
Yeah.
Are you getting paid a stipend?
We have been promised, but it has never come. And at times, with our county government, we were told we shall be getting 2,000, a stipend of 2,000 shillings monthly. But unfortunately, as I'm saying now, right now, county government is owing us 35 months. But
How many months?
35. We have never been paid for 35 months. That is around 3 years, if I'm not wrong. And you'll find that we cannot put down our tools because we are serving our own people.
Of course. If you put down your tools, if you stop.
Even if we put down our tools, we shall be making our people not to at least uplift their livelihood. And another thing, we appreciate our partners. We are working with the partners, such like you. We have Peace Care Kenya, which is giving us kits for malaria. And if you come in, maybe we shall improve more on that side. And another thing that we would like you to assist, to empower us with we have been working with the paperworks,
Right.
data collection and
Yes.
reporting.
Yes.
Nowadays we are coming to electronics, and as you know, we are aged. We were born before this
Yeah. Yes.
come on.
Right.
So we need capacity build in use of this electronics.
Right. To be able
and
to transmit.
Also, it will be good as we are moving in that side. It will be good if we have phones, so that it will be easier also to get a report direct from the ground.
Right.
Yeah, because we can write under the tree, and we give data which is not correct. And when we use electronic,
Yes.
it will be better because it will be taking GPS.
Right. And it's real time.
Yeah, and it saves time,
Right.
and it gives effectiveness of that service. So it will be good also if you come up with a program of providing us with the phone, so that we are used to give data to you in time, not that other data are
Right.
on the way
Right.
before reaching you.
Thank you so much. Asante sana.
Thank you too.